Good morning, everyone. I'm honored to be here with you at Shiloh Baptist Church here in Lexington, the city I grew up in, to highlight an important initiative in our quickly expanding COVID-19 vaccination program. For weeks now, I've been saying our main issue with this highly effective COVID vaccine has been supply, supply, and supply. That remains true. Even as we open up more vaccination sites, we are now at over 291 vaccination locations across this Commonwealth. And supply is still an issue despite every week the Biden administration continuing to increase the amount that comes to us. Today, we're here as we prioritize making sure these life-saving vaccines reach all Kentuckians. That means they have to be distributed in a fair and equitable manner. To do so effectively, there's another issue that we have to take on, and that's vaccine hesitancy, in particular among Kentucky's minority population. I'm pleased to be working alongside everyone here today to address this issue. This administration is taking intentional steps to make sure vaccination programs are more accessible to all. We know African American and other communities of color in Kentucky are not equally represented in the 1A and 1B professions these vaccination efforts in, meaning they were underrepresented in the first waves of folks to be vaccinated. We acknowledge that that is not okay, and we acknowledge that there are deep historical causes of vaccine hesitancy that must be admitted, acknowledged, and addressed. This pandemic did not create the inequities that we see in our society, but it sure has highlighted them in some of the starkest possible terms. It's been particularly plain in the outsized impact of COVID-19 on African American populations and other underserved communities. This is a pain and a legacy that I know I will never be able to understand. What hundreds of years of inequity, discrimination can feel like. What I am committed to doing is listening and trying to hear, trusting key partners, and doing everything I can to help our efforts to do the right thing based on that guidance. This reminds us the time is always right to do what's right. What is right for the Commonwealth as we work to build a better Kentucky is to make sure that this shot of hope is available to all Kentuckians equitably. That is not just a goal, it is an absolute requirement of this administration's distribution of the vaccines. And we're working every day to listen. And what we have heard in our outreach efforts is that Kentuckians want to see and hear from people they know and trust, people inside their community that lead. This, along with fact-based information, should help alleviate vaccine hesitancy. So today, we are taking action based on outreach efforts, and we are thankful to the NAACP and Lexington leaders, in fact, for reaching out to us on this issue. I committed early on that when we were offered help, we were going to take it. And today is the result of that phone call, of everybody wanting to help, of realizing that it's absolutely critical to doing this right, and I'm grateful to all of our leaders for your guidance, for your help, and we look forward to listening and to working to make sure we do this right. Their action, these leaders, is a show of compassion and of leadership. And it's an opportunity when so many of these historic moments going back in time have been done wrong, have led to some of the hesitancy that exists today. When these moments in time we have seen inequity or discrimination, now is a historic moment where we have to do this right, or maybe we can set an example so that the next major moment we do right, and the moment after that, and the moment after that. Until supplies increase, it will take some time before everyone can be vaccinated, but we haven't been waiting. We have been building out an infrastructure right now that can vaccinate 3 to 4 times the number of people that we are actually receiving doses for each week. It includes a regional site we put just outside of Lexington at the Kentucky Horse Park, and we keep adding sites every week. It is critical that the color of your skin or the size of your bank account does not matter in the accessibility of getting this vaccine. We have a historic obligation to meet this moment. All of you here today are helping to make sure that every person in this Commonwealth counts, that every person is a true member of Team Kentucky, and that we will all get through this together. We're steadily expanding who can receive the vaccine as our supplies increase. You can find qualifying information at our website, vaccine.ky.gov. As we announced the other day, we look forward to opening Group 1C beginning on March. Looking forward to that. We've been fighting this war, and that's what we're in, a war, for nearly a year now. The anniversary is coming up. It has been hard on all of us. We've lost over 4,400 Kentuckians. That is a magnitude of loss that is tragic. Most all of us have either lost someone close to us or have very close friends and family members that have lost individuals. Many Kentuckians have lost a parent. Many I know have lost 2. We have to acknowledge the scars that we carry outside and inside, and that even as we come out of this pandemic, it is going to take a while to truly heal. But as I stand here today, I am more optimistic about defeating this virus this year than I have been in any day since March the 6th. And that light at the end of the tunnel that we began seeing December 15th, just that far away, is becoming brighter and brighter. In fact, this week we have over 100,000 first dose vaccines that we are going to get into Kentuckians' arms. We will defeat COVID-19, and we're going to do it this year. So I want to thank everybody at the University of Kentucky, UK Healthcare, which is here today to help us administer these vaccines, for partnering with the state in their mobile vaccination efforts too. It's incredibly important to meet people where they are. We've been doing that through pop-up clinics, through mobile vaccinations, and you are going to continue to see that. We can both operate these large regional sites, but also be very intentional about where we get the vaccine and how we get it to people, and you're going to continue to see these partnerships truly drive those efforts. This vaccine is safe, it's effective, and it is already saving lives. If you want proof, look no further than how our fatality rate amongst people in long-term care has plunged since we began the vaccine program. We need everybody to be willing and able to get their shot of hope when the time comes, because that's how, together, we defeat COVID-19. That's how we come out of this, and that's how ultimately we turn the corner and build a brighter future. I'd remind everybody, until then, we need you to continue to mask up, to love your neighbor as yourself. I learned that in church. And to make sure that we're doing the right things. Until everybody can be vaccinated, if you're lucky enough to have been vaccinated, you still have a real responsibility to do what is necessary to protect those around you. I'm excited to be here today because the leaders that we are here with, that so represent this community and this city, they provide the leadership that is going to help us to make sure that every Kentuckian can get this vaccine. I think now we've got Reverend Jim Thurman, president of the Lexington NAACP, and a friend of mine dating back to when we were helping people not fall for scams in this very church. Reverend?
Thank you, Governor. I am so glad to be here today in more ways than one. I want to thank the governor for being proactive and having these pop-up clinics in the African American community. I know the NAACP talked with the governor and he made it available. He made it happen in the African American communities to have these pop-up clinics. You know, for a while, I had personally decided that I wasn't going to take the vaccine. I'm old enough to remember some of the experiments, particularly read about the Tuskegee experiments, some of the other ones that went on, and I had made up my mind that I was not going to take this vaccine. As a matter of fact, the first time it was offered to me, I refused it. And I was in the hospital about a month ago, and they offered it to me again, and I refused it. And while I was laying there, being a man of God and hopefully living what he was telling me, I was advised to take it. Today, I took my second shot to let you know how important it is. It's a matter between life and death. Now, I said all of that to say that I know how many of us African Americans feel about this particular vaccine. We listen to all the hype surrounding it, how fast it was, how we can't trust the government. Believe me, we must take this vaccine. It's a matter of life and death. And having studied the entire genesis of how it came about, I was encouraged more so than ever to take this vaccine. So I proudly wear my button saying that I have taken the second dose just about about 45 minutes ago. So I advise all my brothers and sisters to do the same. And again, thank you, Governor, for being so proactive and getting this, making it available in the African American community. Thank you.
Thank you so much, Governor. It's great to see you. Lieutenant Governor, always good to see you here. And we've got Representative Brown and Senator Thomas. Thank you so much. Good morning, everyone. And Pastor Owens, it's wonderful to be here in your church today. This historic church, a church that has lived through and helped lead our community through the best of times and the worst of times since its founding in 1896. And Reverend Thurman, Jim and I also go way back through a few things. We could list them off, but we won't. It's great to be here with the NAACP, and you have helped lead our country and our community through many, many challenges. And today, the faith and civic leaders you see here are working together to lead us through this pandemic, which certainly qualifies as being among the worst of times. We have lost more than 500,000 Americans. Think about that. More than in World War II, the Korean War, and the Vietnam War combined. 500,000. Closer to home, here in Lexington, we have lost 232 of our neighbors, our family members and friends, 232. The vaccine, as the governor says over and over, you know, people have to hear things 7 times for it to sink in, right? It's the best tool we have in our toolbox to fight COVID-19. But we all know history is full of reasons, some of which Jim mentioned, that might make African Americans skeptical about public health campaigns. That's why we are so thankful for the faith and civic leaders who are here today. Their leadership will play a critical role in the success of the vaccine in the African American community. We know we have work to do right here in Lexington. Of the first doses that have been administered in Fayette County, less than 6% went to African Americans, even though African Americans in Lexington are catching and dying from the disease at a much higher rate. Just as we took testing right into the neighborhoods, we are working with the University of Kentucky to take the vaccine into the neighborhoods through a mobile clinic, including this one right here at Shiloh. So again, thank you, University of Kentucky friends. We've launched a public awareness campaign entitled Let's Do This, that emphasizes the importance of getting the vaccine when it's your turn. Governor, again, thank you for returning to your hometown of Lexington. It's always good to have you here, and your steady leadership throughout this pandemic has saved the lives of countless Kentuckians. Thank you very much, and thank you to everyone here.
Next, we'll hear from Representative George Brown, who is a friend and fighting the good fight in Frankfurt every day. We appreciate you.
Thank you very much. Good morning.
Good morning.
Governor,
Good morning.
thank you so much for everything you've done for the people of the Commonwealth. Governor, thank you. Mayor, I'm sorry. Promotion. You promote me, I'm promoting you.
He's doing a fine job.
Yeah. It is a pleasure, Reverend Owens, Reverend Thurman. Thank you all for having us here. To my colleague, Senator Reginald Thomas, and to everyone here assembled, it is certainly my pleasure to be here today and join the governor and join the mayor and join everyone in talking about the vaccine and what it means to the people of Lexington and the Commonwealth, particularly people of color. We have always been on the back end. I use an accounting terminology. That was my major in college. It stands for LIFO. LIFO means last in, first out. The African American community understands clearly what that means. That in most things, community and health and economics, and Mayor, we had the conversation this summer about systemic racism and the issues that affect our communities. We've got a lot of work to do, but as I say to my colleagues, as I move around and I talk to people, the question is that how do you eat an elephant? The answer is one bite at a time. If we concentrate on the elephant, we'll never get the job done. So we've got to concentrate on the bites. The bites are the vaccine. That's the purest and only science we have now that will hopefully get us through this pandemic and stop the infections and the loss of life. Governor, thank you so much for what you do. Thank you for having me. Mayor, thank you. I got to go to Frankfurt. All right.
Thank you.
All right, next up, we have Senator Reginald Thomas, and we appreciate that Senator Thomas was one of the first individuals to step up to show that this vaccine is safe and effective. We greatly appreciate his leadership in Frankfurt. Senator?
Governor, thank you very much. And it is so important to be here today because the reason we are here is that we are here to save lives. We are here to save lives. Now, I'm not going to repeat what you've already heard about how important this vaccine is to take and the inequities that we've faced in this country as African Americans for centuries now. But I want to talk about, really, in the short time I have, how well we've done compared to other regions of this country. First, I want to talk about our governor here. Okay. What he didn't tell you is this. Going into Monday, Kentucky was the 8th leading state in the nation in terms of citizenry. 8th, number 8. You know, we fall last in so many health categories. But under this man's leadership, we were the 8th leading state. We have vaccinated now over 16% of Kentuckians. Just a month ago, we were getting 17,000 doses a week. But with his collaboration with President Biden, we're now getting over 71,000 doses a week. That's the kind of leadership he has. I want to repeat something he said so everyone will understand this. A true leader doesn't wait for someone to come to them, just sit back and say, well, I'm going to wait till people come to me and listen to what they have to say. A true leader meets people where they are. And that's what he does. He meets people where they are. That's why he's here today. Now let me talk about our mayor for a minute. While other cities around this country were grappling with the Black Lives Matter movement and were confused and frustrated as to what to do, Mayor Gordon took action immediately. She said, I'm going to lead on this matter. And she formed the Lexington Commission on Social Justice and Racial Equity, comprised over 73 members of this community, and looked at issues such as health disparities, such as housing gentrification, education, and economic disparities. And through forming that commission and through having excellent leaders to lead that, came up with a 100-page document that's not sitting on some shelf anywhere, but she's now implementing and making sure that things get done. That goes to show you what kind of leadership we have here in Kentucky and in Lexington. Okay. Again, I want to thank Reverend Owens, who I've known for years. Pastor Owens, thank you for having this here in your historical church, where you've been such an excellent pastor, not at this church, but just in the community in general, through your social justice leadership for decades. I want to thank you. Reverend Thurman, Jim, my friend, thank you very much. I appreciate your leadership in so many areas, now serving as NAACP president. My lieutenant governor, I've known for years, Jacqueline, and my cousins who's here today, Gina, who's with the AARP. I'm going to close with this, okay? And these are not my words. These are the words of Nurse Takia Talbot, who's going to be putting shots in the people today to vaccinate them. What Takia said is this, because she wants to offer protection to members of the African American community. She wants to protect them so that through this vaccine, they can have years of life ahead of them that they can cherish and continue to embrace the circle of those who love. I don't think you can put prose better than that. Okay? And so with that, thank you all for being here. And again, let's get members of the African American community and all members of the community vaccinated so that we can ultimately end up governor number one in the state of getting our people vaccinated. Thank you very much.
Thank you.
I should have recognized early on my partner in governing, Jacqueline Coleman. I would call her my partner in crime, but I'm worried we'd get articles of impeachment. Oh, did we already? Next up, we have our good pastor, our host today, someone who has been a pillar of this entire Lexington community. And it's voices that when people hear, build trust. And just like he, I know, tends to his flock, his credibility, his ability to communicate with people. When he speaks, people listen. And so we are very grateful that he is lending that voice to this campaign to make sure that everybody gets their shot of hope. Dr. Joseph L. Owens, pastor of Shiloh Baptist Church.
Thank you, Governor. Thank you for your leadership. Thank you, Mayor Gordon, for your leadership. Certainly are honored to see individuals here who are helping to make this day possible. Thank you, Dr. Thurman and the NAACP and the University of Kentucky, and I see my councilman here, Councilman Brown, of this district. I want to say, first of all, that I have received my first round of the vaccination, and I'm due next week to receive round 2, and I'm looking forward to that. I have for nearly a year now promoted the washing of hands, the proper distancing, wearing of masks, and regular testing. And today, I promote the aggressive participation of African Americans, especially our citizens, in this COVID-19 vaccination campaign. For me, it is another step in my moral obligation to keep my people safe and healthy during this pandemic, whereby so that we will have opportunity to live beyond the pandemic, so that we have opportunity to continue to make the significant changes that our people have made to help shape this nation for centuries. Thank you for being here. We will be watching even beyond this day as you continue to help us with the disparity that's going on in eradicating this virus. Thank you, and for all of you being here today.
Thank you.
All right, and last but not least, we have Gina Hayes Sanders, Provider Liaison at Bluegrass Care Navigators. There you are.
Thank you, Governor. And I just wanted to reiterate, I'm sorry I'm a little hoarse today, that I am working in the medical and the healthcare field. I have 5 different counties, and I'm the medical provider liaison. And that becomes important because as I travel throughout my journey, I come into contact with a lot of people. I go into 3 different hospitals. I go into all the home health, nursing homes, and so forth. And even on the street, I have often a lot of people will ask me, the reason people draw to me, and we get into conversations and ask me, why should I take this vaccine? And is it safe? Those are the 2 questions that I get the most. And my response is, and if you're looking at it from a medical and technical background, I'm not going to go ahead and give you a lot of that. I am a biologist. If you look at the technology, the messenger RNA, it's been out for over a decade, and it has been used prior to this application. And so I want to assure my community, I am of mixed race in the African American community, let us know that it's nothing to be to fear, that it's been tried and true. The other question, they're saying, oh, it was rushed to be approved, and that makes me apprehensive. Fortunately, I was a cancer specialist for a biotech company, and I had to do clinical trials. And I just want to reassure, they have to go through each phase. FDA would not have approved it. And then that saying is that the reason it came as quickly is that we've had the technology for so long. So hopefully that can put some minds to rest, to know that we're not guinea pigs, this is nothing new, but we were fortunate enough to have technology that has already been out there. And then I am also lucky enough to have to work in an organization like Bluegrass Care Navigators. They were upfront. They provided comprehensive information. In fact, at the very beginning, we had updates every single day. Dr. Cote is our medical director, and he just, weekly, we get updates, and he just wanted to reassure us as employees that we are doing everything possible in the state of Kentucky to provide information. And please feel free to reach out to your hospitals, reach out to Bluegrass Care Navigators. If you have questions, we are here to support our community, to support you, and to be able to provide you answers to the questions that you may have. And if you see me in the streets, at the grocery store, please feel free to stop me. As you can see, I don't have a problem with talking. So, and I just want to thank Jim Thurman. I came here today just because Jim and I work with AARP. We are the community liaisons for Fayette County and surrounding counties. And he often hears how I have been asked about why should I take the vaccine. And that's what prompted him to ask me to come and talk to you today, because I belong to about 5 civic groups, like the Department of Aging and so forth. So I just want to thank him for this opportunity. I want to thank our governor and our mayor and everyone else. And please, reach out to us. There's no secrets here. We're happy to answer any questions that you may have. Thank you.
Well, we'll answer just a couple of questions, and then we have 10 very patient individuals that want to get their shot of hope. By the way, walking into a vaccination clinic is a moving experience. It's also interesting for the first time ever to see somebody really want a shot. Oh, I mean, people are excited for it. They're ready. Anybody?
I have one question. I talked to a woman earlier today. She's over 60 years old. She's a minority, lives here in Lexington, and is a frontline worker. She says her main hindrance is not hesitancy. She wants to take the vaccine. The issue for her is getting signed up on the right list. She feels
Right.
like she gets bounced around a lot on phone calls and just isn't sure where to turn to or where to go. What should she do, and what would be your advice to her?
So 60 and up, all essential workers are in 1C. That opens up March the 1st. It's going to make it a lot easier. The challenge right now still is supply, and it makes it feel like it's really hard to get an appointment. And that's true because there just aren't enough shots to create enough appointments that we need. Certainly in Lexington, there are a number of options. There is the major UK site. There is the Kentucky Horse Park site. There are the federal pharmacy sites that they have now put online. So those are 3 separate platforms. You want to try each, and you want to try them just about every day until you get the appointment. Now, really important, you don't want to actually get an appointment with more than one. And we got to make sure once you get the appointment, you get off those other waiting lists so that we make sure that we can fill that. But it's going to become progressively a little bit easier and a little bit easier and a little bit easier as we get more vaccine in. Today, we've got some pretty promising news on Johnson & Johnson, that they have received at least the first step they need to get that emergency authorization. That is a very effective vaccine. There is some discussion there. It's a very effective vaccine that almost completely eliminates severe reactions, severe illness, and death, and it is one shot. We expect to get about 26,000 of the initial allocation when that comes out, and that'll be 26,000 people too, so it'll pick up. So I'd ask everybody, keep trying, try to be patient. I know it's hard. Everybody really wants this shot of hope, but we're going to get there, and we're going to get there by the summer. I'm confident that absolutely everyone in Kentucky who wants a vaccine will get it by this summer. I hope earlier.
I heard you talk about it a little bit earlier.
Yeah.
How do you feel about the impeachment petition being dropped?
There were never any impeachable offenses in that petition. It was filed by individuals that lost in the Kentucky Supreme Court and didn't want to accept that. That's not the role for something like this, and it ended up with multiple officials having different things filed against them. You know, with everything we've seen that's going on in our country, it's time we get back to treating each other right and to respecting the role of government and how it works. Not trying to undo, in this instance, an election that was a little over a year ago. So I think they made the right choice. Now I hope that in Frankfurt we can all be adults in the room and move forward and leave it behind, but we'll see.
Governor, I know we've had similar events where we've heard from our African American leaders, but what's being done on a daily basis to reiterate this message?
So on a daily basis, we are trying to bring the vaccine into the community in areas of trust. In many places, those have been churches. They've also been different community centers, and we're going to continue to do that. We call those either pop-up clinics or they're the mobile vaccinations, because people can walk up and walk in, which is really important to address challenges that some may have with technology. It's also important that when we have an equitable program, that it's serving its goal, that those vaccines are actually reaching and going into the arms of the members of the community. So we have to do better than what we have seen thus far. I've talked about, I think that we have programmatic issues. We're working to address those right now. We have societal issues with 1A and 1B and how we need more diversity in our teaching ranks, in our healthcare ranks. And then we have historical hesitancy that, again, we're working to address. But I'm optimistic because of the leaders that you've heard from today that are offering help, that are stepping up and speaking out, even if not asked. We see leadership, folks like Clark Williams, who didn't talk today, but I see him back there. We're going to get this done, but we've got to be very intentional to make up the ground that we need to make up as quickly as we can. All right, let's vaccinate people.
Oh my gosh, thank you so much.
Absolutely. Yes, sir.